All right. We are back. Episode 5.
Cinco.
Cinco.
Uno,
Yes.
dos, tres, cuatro. Cinco de Mayo.
Yeah, I wish it was May.
Yeah.
February in the Northwest isn't the best. Not bad today, though.
Yeah. Chris, you want to bring up what I'm wearing real quick?
Let's
Just
see.
The comfort level.
Yeah.
I look pretty comfy.
You do look pretty comfy. You mean specifically what you're wearing?
Just I want you to rate my comfort level.
It's pretty high.
Okay. You know why I did that?
No.
Because we're going to talk about sleep today.
Oh, excellent.
And I got comfy.
Yeah.
And I want to be comfy because we're going to talk about sleep and we're going to narrow down some issues with sleep.
You know, I should have gotten you one of those Snuggies. You've seen those things?
Have to. I thought about bringing it. The one with the lamb-ish interior. Mm-hmm. Lamb. Mm-hmm. She knows. I thought about bringing it and doing the whole podcast, but we have this Terminator level heater that I thought would just cook me out and I'd start sweating.
Yeah. It might catch you on fire, too. That wouldn't be good.
Might, yeah.
Yeah, it's not surprising that you have a Snuggie. I didn't know that until you confirmed it.
2 shades. Red, more of a crimson.
My daughter will love the fact that you have a Snuggie.
Good. I'll mail her one. So, we're talking about sleep.
Yeah, we are. And I thought this was a really good one to do right after that kind of monstrosity of episode 4 with the stress cup. Because people are like, okay, well, that's good. Here, this is what filling my stress cup. And, we talked about sleep, bad sleep, is how it filled it up quite a bit.
Yeah.
So I thought we'd start doing podcasts and, how do we kind of empty it a bit?
Pookie, are we recording video? Have you hit record on the ATEM?
Yeah.
Just making sure.
All right.
I didn't confirm it. I think that's another set of eyes. So
Awesome.
sorry about that. Yeah.
No, it's okay.
I think it dovetails perfectly into from the stress episode into naturally. This is
Well, and sleep is probably the most, if we start looking at recovery, sleep is the most important thing, I think. If we had to prioritize one thing, people talk about supplements, all these different things. This can make or break you. In other words, good sleep can empty your stress cup. Bad sleep can just fill it up big time. And so I think
because that was part of it when you would pour it out, but you wouldn't pour all of it out.
That's right.
That's mimicking the sleep session.
That's right.
And obviously poor sleep is going to make it so that thing only emptied a little bit.
That's exactly right. And but instead of just telling people what to do, and I think it's really good to kind of understand what sleep is and what drives it, and some things we can do to optimize it that people may not have thought about before. So sleep is part of our circadian rhythm. You've kind of heard about that before, right?
I've heard of it on some like woo-y kind of like National Geographic show.
Oh, okay.
And I was like, oh, this doesn't make sense. Like the stars are aligning. I don't know. And then I realized it wasn't like hooked up to astrology.
I was going to say, no, it's not astrology.
Yeah.
And not that I'm,
crapping
on astrology. I'm just saying that
it's not necessarily
it's
connected.
at all. What circadian means is literally about a day. And circadian rhythm is basically our daily biological rhythms that our body and brain go through. And sleep is part of that. And what's interesting, before we even get into sleep, is talking about what drives that circadian rhythm. It's really interesting, and it's not just an analogy, there really is a master clock in the brain that keeps track of these things and puts us on the cycle. And what's interesting is, left on its own, the clock is set to just over 24 hours a day. And we'll talk about that too later on. If you just had it running without any external cueing, like if you put someone in a cave with no exposure to anything, they would slowly get out of sync with the day-to-day life because it's just a little bit greater than a 24-hour period. Okay. Why that is, I'm not really sure. I don't think anybody really has figured that out.
Sure.
So the master clock is if you guys remember us last episode, we talked about the hypothalamus is kind of one of the big kind of orchestrators of the stress response. We went through that whole hypothalamus, pituitary, adrenal thing.
Okay.
So hypothalamus is multifunctional. And there's a part of it, you guys don't have to, you won't be tested on this, but for people that are nerds, it's the suprachiasmatic nucleus, SCN, is the part, I know, it's part of the hypothalamus that really kind of regulates this clock. And the clock is really interesting. I have some notes here to keep me on track, because otherwise I love this stuff and I'll geek out. And I think I don't want to go.
Nerd alert.
Yeah, super nerdy.
Got those glasses going.
Right. So what the clock is, it's what in molecular biology we call a transcription translation oscillating loop. What does that mean? Oh my gosh.
You're losing me already.
I know. You're like, oh my God, turn this off right away. Let's break that down a little bit. Yeah. Transcription is taking something, part of your genetic code, your DNA, transcribing a message onto RNA. And then RNA takes that message and makes it into a certain kind of protein, depending on the sequence and all of that. That's the transcription translation. The oscillating loop just means it wavers up and down, and it forms a loop, just like it says. And I'll give you guys a perfect example. It's self-regulating. In other words, if we were to set up an assembly line making chocolate.
Sure.
You like that?
I mean, let's go.
But we'll take that assembly line and wrap it around so the end of the assembly line comes back to the beginning, like a circle. Mm-hmm. It wouldn't make sense for production, but let's just say we did that. Mm-hmm. You are sitting at the end of this assembly line, right next to the beginning of it, the machine that actually makes the chocolate. The chocolate is made and it goes around the loop. And then at the end of the loop, let's say there's this scale. And the scale has a switch. So as the chocolate loads up on it, it turns off production of the chocolate.
Okay.
But you're at the end of it, and you're eating that chocolate.
Yes, I am.
Yes. Well, I know. That's you're a perfect example. So we're going to employ you in that. So
I had 2 big cups today.
He did.
So let's make it Reese's. Let's say that we're producing Reese's cups. Cups?
Yep.
You like the cups? Okay.
Please, thank you.
So we're going to those are going to be made. So you can think of those as little proteins. Mm-hmm. The DNA has made the message, which makes the protein, makes a Reese's cup. It goes around, all around the loop, and then it gets onto that scale at the end of the loop. After a certain amount is made, it's going to compress and it's going to stop production. Okay? So, but then you're going to eat some of that chocolate that's on the scale. And after a certain amount of time, you're going to eat enough of it so where the scale is going to kind of come up and it's going to make production go again.
Tracking.
So that's very similar to how these clocks work in all of our cells, and especially the hypothalamus. So we're making a protein. The protein will keep being made till it gets to a point where it accumulates to the point where it actually represses its own production, so it stops it. Okay. Then after the body starts degrading that protein enough, then it will start it again. Okay. So that cycle forms a time period, and it happens to be a little over 24 hours. So those type of clock systems are in pretty much, now we know, almost all cells in our body, especially the organ cells. You can think of them as, if we're like in an orchestra, there's a conductor, right? And then there's the individual musicians. The conductor is kind of driving the song and getting everybody in sync to actually create a piece of music. They're not just called running off by themselves. That's what the hypothalamus does for the rest of the body. The hypothalamus has its clock, and it signals to all the other organ systems like, hey, this is our cycle. So that's why it's so important. And so does that make sense so far as how
you laid that out beautifully?
Oh, I'm glad.
I'm on track. You pacing over there?
Oh yeah.
So you like the Reese's Pieces circular assembly line?
It was beautiful.
Okay. So what the hypothalamus, like I said, it regulates the organ clocks, like the liver, the gastrointestinal tract, the kidneys, the immune system. I mean, everything, it regulates it. And what it does is it tells these organ systems, hey, are we in an activity mode Do we got to do stuff? Do we got to power the body? Like during the day, we're active.
Like produce more of whatever.
Whatever it needs, or whatever processes need to happen to support your activity during the day. So we'll call that activity mode. Okay, we'll have two modes. We'll have activity mode and kind of regeneration, restoring mode.
What are a couple things that would be activated in activity?
We'll tell you that here in a second. But we're going to go through some examples to kind of solidify that. So the hypothalamus should signal everything and say, hey, we're going to go into activity mode and that should correlate with during the daytime where most of us are active. Then at nighttime, it should be signaling the organ system like, hey, let's switch over from activity mode to more of a restoration, regeneration mode. So all these organs will start to do different things to support that as well. So that's kind of how the circadian rhythm is important with that. So let's give some examples. So I'll actually refer, gosh, I hate to do it because I'm going to get a drum hit, to the book to Strong Medicine.
Oh, yeah.
You got to turn the volume up.
Okay, gosh, I have to wait on that.
Keep that volume up, please, because we're probably going to be hitting that a lot.
So let's give some examples. For instance, let's go to the adrenal gland. And we talked about that last week in the stress cup lecture. The adrenal gland secretes those stress hormones. So, for instance, early in the morning, to prepare for activity, the adrenal gland secretes cortisol. Okay, so that's kind of under circadian control. And then in the as we go through the evening, we want to reduce the cortisol levels, so the clock is going to kind of regulate those different functions of the liver. Like, how does it know when to produce cortisol and when to kind of, not the liver, the adrenal gland, and to produce it, or like, hey, let's stop the production.
Right.
That's all by the clock. The heart, same way. So if we're in activity mode, we're going to prepare all these systems to support activity, exercise, everything like that, because the heart has to be prepared for that. Where at night, it's less responsive to that type of thing. It goes into, like everything else, into more of a regeneration rest mode. Still working, of course, otherwise we would die. But it's usually not under the type of the needs of like training jujitsu and all that stuff that during the daytime. The liver clock, so during the daytime, it wants to, can store glucose during daytime activity. And then at night, it can release that glucose to fuel the brain. So you get the idea, and that includes stuff like fat cells, the muscles, the immune system, the kidneys, our GI system. All of them have different functions depending on whether we're, what we're supporting, either activity or regeneration. So, and again, all that's controlled from the hypothalamus to regulate either activity or rest and regeneration.
Hey, Chris.
Yeah.
I read recently something about like how probably like the circadian rhythm would affect your heart, or why a lot of people have like heart attacks in the morning, or especially daylight savings.
And I was going to rant on that at the end of the podcast.
Sorry.
No, that was an excellent question. I was going to get on my little soapbox about that ridiculous time change stuff, because you're exactly right. And I'll just go do it right now since you asked.
Juice them up.
So if you've had... So, I'm serious. I'm taking my glasses.
Are you serious,
I'm
dude?
taking my glasses off right now.
Hide the kids, please. Yeah, smokes.
If your stress cup, for instance, you have heart disease, diabetes, you're older, we all saw that last week where you probably have your stress cup is right on the brim. It's not going to take much to tip you over. And when you have what's called circadian disruption, and you're like, well, what's the big deal? It's just an hour, right? That's a big deal, because that is a stress on the system where you and I can, it's irritating. I feel tired and I'm just not at my best until I adjust. Someone like that can put them over the edge, like the proverbial straw that broke the back of the camel. And so we do see an increase in heart attacks and things like that during those changes, especially going to springtime where we spring forward and so-called lose an hour. That adjustment is a stress on the system and adds to your allostatic load, or AKA the stress cup. So that's why that happens. And it is it's an antiquated thing. Our state, Washington, a couple years ago actually passed to get rid of it. But the federal people up there, they're not doing their jobs in Washington, haven't gotten around to ratifying it. So we're still stuck in that, and we're still needlessly killing people, so to speak. So I feel
there's no need for it. It just doesn't.
No, and I feel very strongly about that. My medical specialty, my subspecialty in occupational medicine, we deal with this all the time with shift workers, and we know what it does to them. That circadian disruption. So it makes me crazy, because crazier than usual, because we don't need it, and it's just Anyway,
I was just at class this last week, and during the midday, and there is about my age. I think he's like late 30s.
Yeah,
roughly, and he's worked the late shift his whole life. He's
like overnight, like the third shift.
Yeah, he's always been kind of a night owl and stuff like that. And he was saying, and Olivia, you were there. He was saying that now that he's on a more normal schedule, he's feeling better, right?
How old is he, by the way? Just a guess.
I mean, he's got to be probably 39.
Okay,
I think.
So he's at the point where that was a really good health.
He's right in there.
And look, we're going to talk about that here shortly. But if at all possible, and you have the opportunity to get off of shift work, it is one of the best things you can do for your health. And we're going to talk about that here a little bit. So backing up a little bit, I'm talking about the circadian rhythm and the fact that it's a little more than 24 hours a day naturally without any other influences. Well, what are the influences that kind of set that rhythm?
Cocaine.
Cocaine.
Well, I feel like that stretches your day.
So you're saying it keeps you more alert when you should probably be sleeping?
Yes.
Okay. That doesn't drive the circadian rhythm. I would consider that a disruptor of the circadian rhythm.
Okay. I'll accept it.
Excellent. Do you have any guesses what the biggest stimulus is for the circadian rhythm? Anybody, Olivia? In other words, what regulates it?
Sunlight.
Oh,
yes, light.
Sunlight.
Good job.
Thank you.
I'm so happy.
First guess cocaine, second guess natural cocaine. Sunlight.
So it's really interesting. So we've actually looked at this quite a bit and figured out how this actually works. Have you guys been doing any camping? Have you done so in the past?
Probably when I was 12.
Okay. You may not have remembered this. Especially if you go like real camping, not
RVing.
whatever that is. Okay. If you're out there and you don't have any ambient sources of light, you're out there in the dark woods somewhere, you might have a fire going. Do you notice, or have anybody ever come across and talked to you about it, where as soon as that sun goes down, people start getting tired a lot earlier than they would if they were back at their house?
Well, that's kind of, you hear your grandparents, if you talk to them, that was a common thing, is you wake up actually when the sun rises.
Exactly.
Which right now, for a lot of people, that'd be nuts.
Right.
And you are done working when the sun goes down, and then shortly thereafter, not long after, you're actually going
and
to
there's
sleep.
a reason for that. It wasn't because, we didn't have a lot of, I would say before Edison, we didn't have
You were
these.
in middle school at that time?
I was a little older in middle school. Very good. So how does it regulate that? And this is really important because it's going to get to what we're going to talk about to kind of optimize your sleep here. So light is huge for this, and a certain portion of light is actually very important. Everyone's familiar with the rainbow, right? Red, orange, yellow, blue, indigo, violet, right? Or green, I missed green. Red, orange, yellow, green, blue, indigo, violet.
Yep.
Those are in order of descending wavelength. So red is the longest wavelength of light in the visible spectrum, the stuff you can see, and violet is the shortest.
Okay.
Okay. And, you know, blue is near the end of the short end. Red, the oranges and yellows are near the long end. Well, it turns out that the wavelength of blue, what that does, it hits the retina, which is the back of your eye. And there's a special type of cell called the retinal ganglion cells. They actually blue light stimulates them. It sends a signal to, guess what? The hypothalamus. And it tells the hypothalamus to stop melatonin production. So blue light, which is a part of natural sunlight.
And that's what we've
The
heard.
light in the room right now,
Yeah.
broad spectrum light.
This bad boy.
That's right. Screens, TVs, stuff like that.
John Giacomi.
Oh, solid. But
Shout out. CM Heating.
you trying to get a sponsor?
Right. John, talk to your boy.
That's hilarious. So that will shut off melatonin production. Melatonin, we're going to talk about very shortly, is really important for setting up sleep. So if you're turning it off artificially, for instance, like if we have a campfire, the sun goes down, all we have is a campfire at night. What color is a campfire?
Right. You're going to have that nice orange.
Yeah.
It's kind of.
Like the thing that's lighting you up, where I have the blue one over here, right?
Yeah.
It doesn't
Devil.
matter. We're both
You are
bathed,
the devil.
but we're both bathed in this
Good.
white light, which is a combination of everything.
Which is, I think that temp is actually considered daylight, like 5,500 Kelvin.
It's measured in color temperature.
Yeah.
Right. So that has the blue light spectrum in it. Okay, which will inhibit melatonin, which the hypothalamus, just to go back a little bit, the hypothalamus signals the pineal gland, which is a tiny little thing in the brain, to secrete melatonin. So if we're at night when the sun goes down and we're out camping and then we have just firelight, we're not really having a lot of blue light spectrum in that. It's more, or have you ever noticed, what does a sunset look like?
Right. Right.
It's
Ooh,
what?
all these
oranges,
warm
or
colors.
and that's the angle of the sun to the atmosphere, producing the long wavelength light gets through. Anyway, that absence of blue light then starts the brain producing melatonin.
Okay.
Makes sense, and that's
the
why at night.
sleepiness and-
Yes. So if we're at home, we get home at night, and we have these lights on, or let's say we read before we go to bed, or we have a TV in our room. We're still getting a blue light exposure. And by the way, it takes melatonin a good 2 to 3 hours to start ramping up completely. So,
Liv, what were we going to say?
were you going to say something?
Oh, well, I was just going to ask, back in the day when they first created, electricity and the light bulb, I don't know if you would know this, but has it always been blue light? Or
So
that kind of?
it's more, again, you can, like Bill was talking about color temperature, you can buy bulbs. We'll talk about that in a little bit. But the more broad spectrum, so-called natural light, is all the wavelengths.
Okay.
Okay. And you can get them more over to the longer ones or more to the shorter ones, depending on how you construct it. But I don't know the answer to that, but I would probably say they're probably
Well,
are.
I think in the very beginning, the lights were quite warm, as in temperature.
You know better than I with your.
Well,
background.
it's more just those tungsten kind of
Yeah.
lights that are in your bedroom.
Yeah.
Your lamps are almost always like that.
Yeah.
That'd be like 3,200 Kelvin.
They should be.
Right.
They're not devoid of
Right.
blue
Especially
light.
modern.
Yeah.
As we get more modern with LEDs and stuff like that, they are actually a little cooler. And then your bathroom lights are the ones that are typically kind of like this one, which is 5,500, 5,600, something like that. But I believe the tungsten lights a long time ago were very only warm.
Oh, interesting.
Yeah.
Oh, that's cool. But the higher that color temperature goes in Kelvin, the more of the short wavelength light you have. As if you go towards what you call warmer,
Yeah.
then that is typically the longer wavelengths.
Yeah, yeah.
More. So
Which is basically the example you see here with these two. Is
these two
almost
lights
example.
between us two. So you can imagine if I want melatonin, we'll talk about melatonin here in a second, but if I want natural melatonin production to happen and to have me fall asleep, if I'm reading right before bed or watching TV and I have, blue light exposure via these broad spectrum lights, I'm sending a signal through my retina to the hypothalamus to the pineal gland to not allow melatonin production or kind of inhibit it.
You're filling up Reese's Pieces on that scale.
Well, not really.
Talking about your scale is full of Reese's Pieces. This is a callback. So now your body is not producing.
So the clock, that's a little different. That has to do with the natural rhythm, the circadian rhythm.
Okay.
And yeah, so no, it's a stretch, but yes.
Thank you.
Okay, there
Thank you. There's some other retard that also got it.
We could tie that in, because if you're kind of disrupting the circadian rhythm, it's a little. That's not a bad try.
Okay, thank you.
Okay,
that's all I need. It's a good try.
It's not a bad try. So, and in the morning, we want to definitively cut off melatonin with bright light exposure, ideally from the sun.
So, spitballing.
Yeah.
Is morning grogginess a lack of that part? Like melatonin is still producing. We're trying to wake up. We're waking up, but we're this.
Part of it, yes. And that is why people use stimulants.
Cocaine.
Or
caffeine.
Caffeine. Exactly.
Legal cocaine.
Legal
Why
cocaine.
do you always go to cocaine, Bill?
Have a tough past.
Yeah, it's
that
okay.
we'll talk about it.
We can talk about that later. But it would work the same way.
Right.
Yeah.
Stimulant.
That's exactly right. So we're going to get into more of that.
But what I was basically getting at is that just like going to sleep, it's similar just on the other end, where you're still producing melatonin, but it's time to get up.
That's right.
Okay.
And we're going to talk about melatonin and why that's important here in a second. But that's exactly correct. And we'll hopefully tell people how to kind of optimize their circadian rhythm, which will then give you the best framework for good sleep. And it's not completely but it's a
best
huge
practices kind of thing. Okay.
Well, we're going to talk about that. So light is the thing that entrains, in other words, sets the clock.
Okay.
The other thing is temperature. It's really important and it's often overlooked. So we have a natural cycle of body temperature throughout the day and night, where we achieve our lowest body temperature in basically early morning. We hit the lowest body temperature, and then as cortisol ramps up and we get ready for activity, body temperature will ramp up.
Well, when cortisol starts hitting, or when it's just making
when it's starting to make
okay.
because cortisol is also under a circadian fluctuation, right, where we get a big bolus in the morning to kind of wake us up. But that's when we also our temperature starts rising through the day.
Okay.
And then it will rise, and then it will slowly, as we go to sleep, start to fall off and then hit its lowest point during the night.
Okay.
Or early morning. And so that also regulates, is an input from the environment, could also stimulate that. So if you're trying to sleep, people probably when you're sleeping, it's super hot and you can't, you're basically, you're inhibiting that natural cooling process.
I feel like a pregnant lady half the time. I am going through hot, cold, and everything.
A lot of us have a lot of problems with that, and we'll talk at the end some things that, if you really want to delve into that I found really helpful for me. So anyway, we've talked about the circadian rhythm, and basically that melatonin is under control of the circadian rhythm, which is under control of light, dark cycles and stuff like that. So it's a good time to start talking about what is sleep at this point.
Okay.
Sleep is part of the regeneration recovery mode, so to speak. And it's built, we call it sleep architecture, just like you're building something. There's stages of sleep. Long ago, it was thought that there were 5. In about 2008, American Academy of Sleep Medicine combined stage 3 and 4 to one stage. So just so you guys know, so you're not confused, because you'll still see on the internet, so people start talking about stage 4 sleep, and they're talking about what is now stage 3. I know it's semantics, but it's important, because then people will go on the internet and like, well, this says something different. A lot of people haven't updated. We're trying to use very consistent nomenclature so we all know what we're talking about when we say it. So what happens at night is we cycle through these 4 stages in different amounts. So stage 1 is as we're drifting off, and we go, you can think of the analogy of going deeper into sleep. Where stage 2, you'll fall down a little deeper.
So stage 1, we're saying like I'm awake, but I'm kind of nodding off, or I'm already.
You're almost in that kind of. Have you ever kind of know what's going on in the environment? Like after you wake up, you're like, oh, I thought I was
sure.
here. Yeah.
Sure.
So that's a light
I get a lot of those. What are those kicks called?
periodic leg movements.
Like where I'll be laying there. No.
Oh, that's the kind of the jolt. Yeah.
Yeah.
So
Is that kind of in that?
yeah.
Okay.
So it's typically what we call lighter sleep. When people call deep sleep, we're talking about what used to be stage 3 and 4. Now we've combined them to what's called stage 3.
Okay.
And what's really interesting is
But stage 1 is
kind of just as you drift off.
and you can kind of open your eyes and be like, okay, I still know.
You
what's
can
going
be
on.
aroused very easily.
Okay. And then stage 2.
Stage 2, it takes a little more to arouse you. Stage 3, it's real. When people are in deep sleep, it's like, you know, have you ever been woken up from like a deep sleep? It's you know, it's kind of hard to get alert really quick. And that's because the brain goes through different electrical stages. You actually change, you know, basically when you're relaxed and trying to go to sleep, your brain is what we call alpha state as far as its electrical, the characteristics of its electrical signals. Then you go through down to what's called theta. You don't have to know this, but as you go down deeper into sleep, your brain waves change. And then deep sleep is characterized by this very slow electrical activity called delta or slow wave sleep. And that's when a lot of really important things happen for your recovery. And we're going to talk about, that's going to be a really important thing to talk about. After slow wave sleep, you get into a period of rapid eye movement sleep, REM sleep, people have heard about. Okay, where dreaming and stuff like that, REM sleep.
Yeah.
Right. The other stages are called non-REM sleep. So stage 1 through 3 is non-REM and stage 4 is REM. The interesting thing is you cycle, think of it, you go up and down throughout the night through all these stages, but you spend more time during the first part of the night in slow wave sleep, and you spend more time in the later part of the night, early morning, in REM sleep. That's normally how the sleep architecture is built.
So when you get woken up in REM, I always associate it like when I will think I'm in REM when I get woken up and I'm in a different dimension.
Yeah.
And I'm just,
Yeah.
I'm like a newborn baby, Tyrannosaurus Rex coming out of the womb.
Yeah.
I don't know where I'm at. Is
REM,
REM?
that disorientation, REM sleep is really interesting, and we still don't know a whole lot about it and its purposes. We have some ideas behind it.
But I'm saying when you have that feeling where you probably, is that true? You were probably in your T-Rex mode.
You could be. I would have to,
Okay.
the only way to know is to
like a
hook you up on a sleep study and look at your electrical waves.
Okay.
REM sleep looks really different. And what's interesting in REM sleep is most of the rest of your body is paralyzed except for your eyes. It's really interesting.
Okay.
So you actually have a little muscle paralysis. Have you ever
Yeah.
you ever been like in between sleep and your brain starts moving and you're like your body feels like it can't
Maybe
move?
you had that like
Sleep paralysis they
somewhat
call
recently.
Yeah.
it.
Yeah.
Yeah. So that's kind of a thing associated with REM sleep where it's a little. And, you know, I don't claim to be a complete sleep expert and understand all of the mechanisms behind all these different sleep disorders.
Yeah.
But that is part of an REM
Okay.
phenomenon
Okay.
because you do have muscle paralysis during that point.
Interesting.
It is quite interesting, actually. So the purposes of these things are really important to break down. The first part of the night where we spend more time in that delta slow wave sleep is where a lot of really cool things happen as far as recovery and regeneration. And we'll talk about that here in a minute. Matter of fact, I think we'll talk about it now because I think it's a good idea. I'm putting on my glasses, so we're about to get busy.
Man. Got a whole lot sexier in here.
So one of the big things that happens during slow wave sleep or deep delta sleep is we get, as far as, especially for performance and recovery, is we get our biggest dose of growth hormone during that time.
In REM?
No, in slow wave sleep. Remember, the slow wave sleep, stage 1, 2, and 3 are non-REM. And then we have REM is more of the later. We do cycle shortly through REM during the early stage of the night, but we spend more time in this slow wave
And that's
non-REM.
when we're producing the
Yes, the growth hormone.
good stuff?
Yeah. Well, REM sleep does some really important things too.
Sure,
We just don't understand it as much as we understand
Okay.
what slow wave sleep does. So, and you get into that within the first couple hours of sleeping, that delta, that slow wave
So
sleep
my naps can be good?
during the day. It's a little different. But
Okay.
yes, they can be good for a different reason. That I hesitate to talk about that. That can get really complex, and people might turn off this thing sooner than they would otherwise.
People like naps. Just saying.
Yeah, no, but naps are really good for another reason.
Okay.
That decreases another part of the sleep system, what I like to call the chemical sleep system with adenosine. Well, we don't need to necessarily go. I really want to hammer the importance of this. So growth hormone during that slow wave deep sleep, stage 3, whatever you want to call it, delta sleep, they're all the same thing. Growth hormone secreted in response to, if you did a really hard training session that day, you'll have the kind of more intense training session, you'll have a bigger bounce in that growth hormone. So it is correlated to the intensity of your training. I mean, you'll still get it, but like if you did a pretty heavy rolling session and did.
So why, on those days, whether I trained hard or I did a 2 a day or maybe I just worked, I had a long work day. I didn't actually exercise, but I just had a long work day. And I go to bed.
Yeah.
And it seems like my sleep is better on those days when I have exerted myself. And there's a very popular Jocko clip where he, talks about like finishing the day and like having, accomplished and physically. And
it's a little different, but yet in other words, you feel like your sleep is better.
It does. Like when I have really exerted myself through the day or at some point in the day. Yeah,
that's right. And we're going to talk about that too. Okay. And all I'm saying is if you did it during that day, had a pretty good physical input, especially, you'll have more growth hormone during the sleep. But you got to make sure you get into that slow wave sleep. And that's what we're going to talk about, what happens when that doesn't happen. So anyway, growth hormone does a ton of stuff. One of its main functions, though, is to spare muscle wasting during fasting, which people are not eating at night typically while you're sleeping. So during that time where you're not getting any energy input, growth hormone then helps mobilize your fat stores for energy while you're sleeping, and it also helps stop the breakdown of muscle.
This is why athletes will use this stuff as a PED for more so, not necessarily to like get big and stuff like that, but it's more of like,
it's
I want to be able to train more.
Yeah, it's sparing the breakdown of muscle. It's not something I definitely don't recommend. When you start introducing, unless you have a very good reason, introducing outside hormones into your body, and we'll be talking about testosterone replacement and stuff like that with my spouse here soon when she comes on. But with growth hormone is really, really important. So if you're not getting that deep kind of slow wave sleep, you're not really getting a big whack of that growth hormone, which can lead to poor recovery, amongst other things. Testosterone is also secreted during this time in males. It's really important for the whole recovery process and to kind of regenerate things. Also, during slow wave sleep, events of the previous day are stored in the long-term memory. So if you're learning some new stuff and you're trying to retain that stuff, whatever it's academic or even if it's, motor skills like, new moves and stuff like that for jiu-jitsu, like, hey, we just worked on this new thing I haven't worked on before. If you're getting more slow wave sleep, it's more likely that that's going to be stored better. Okay. So which makes sense. And for longevity, during slow wave sleep, that's where most of your cellular and DNA repair of the body comes from. Basically the workers come out and they, we have a little DNA damage or, cellular damage. That's when that happens. It kind of repairs it. So if you talk about a longevity perspective, getting sleep is super important, especially that quality sleep. People say quantity. I mean, you could lay in bed for 8 hours. It doesn't mean you're getting quality sleep.
I've done it.
Right? So that's really important. So if people are trying to, quote unquote, lose weight, body composition change, and they feel like they've dialed in their nutrition, their exercise and all that, and they're still not making gains, I always look at sleep, always. Because if
you have them do like a sleep journal.
Yeah.
I mean, I don't know.
I don't know. It's a good question. It's so hard to say what's really happening unless you had someone hooked up to the electrical.
So if you're really running into a roadblock where you're not BSing on your diet.
Yep.
You are working out appropriate levels.
Yep.
Consistency's there.
Yep.
If you're not seeing some obvious blood work with your doctor, then sleep should be right there.
First thing, because not only do you want that growth hormone, which is a primary fat burning thing at night, but you're also, this is another thing with sleep disruption in general, is you're getting basically a stress response. You don't want that anyway, because your body is like, well, you're not giving it the restoration it needs.
Yeah.
It's a stress cup thing. That's why that happens. So.
Okay, so basically.
Yeah, go ahead.
Someone isn't going to know whether or not they're getting that slow wave sleep unless they are hooked up to like a.
Yeah, sleep monitoring, polysomnography. It really is. You can tell when you're well rested or not. Even if you had your eyes closed the whole time, if you wake up feeling like I don't feel recovered. It's one of those intuitive things. When you've slept, or when you wake up, you're like, man, I feel good.
Yeah.
There's a qualitative part of that that's really important as far as that goes.
Qualitative?
Yeah.
Or quantitative?
Qualitative, as opposed to I feel like I got good quality sleep. As opposed to I got 8 hours of sleep. I think I was asleep for 8 hours, but I feel terrible.
What would quantitative mean?
Like how many hours of sleep I got.
Quantity.
The quantity.
And then quality.
And quality. Yeah.
I'm coming away with
You're
something
doing
today.
awesome, man.
Thanks.
It's making
Mom's
me
listening.
It's making me warm inside.
Yeah. Hey, Mom.
So, yeah, just using that terminology, it's the same point. Is you can get the time slept maybe, but what if you're hovering around and kind of restless, you're not really getting that deep restorative sleep?
Yeah.
That's still not. You're not getting all that recovery and all the benefits of it.
Maybe I'm jumping ahead.
Yeah.
Slap me if I am.
No.
If I am, maybe off topic, I don't know.
Yeah.
There's people that, I bring up Jocko because he's just popular.
Yep.
People have heard him a bunch.
Yep.
He talks about getting, I think, 5 hours
That's
of
right.
sleep or something like that.
Yep.
He obviously has the very popular, takes a picture of his
Yep.
watch in the morning. It's 3:30, 4:30, whatever.
Yep.
So there's people getting that 5,
Yep.
6 hours, whatever,
Yep.
and they feel good. They can
That's
still
right.
be very efficient and effective in their day. But then there's some people that are like, I know I need 8
Or 8.5.
Sure, 9, something like that.
Yep.
Like to be effective,
Yep.
like truly optimize. Like, sure, that person could get 6, but they're going to feel like crap during the day. They're not going to perform as well, but they know themselves. Why is there that difference? Is Jocko just being tough?
Nope.
Okay.
Nope. There are different things. We call them chronotypes. Chrono just means time. There are people that tend to do better staying up a little later, and they are more productive. It's not everyone, but when we look at the general population is kind of what I'm giving the results to. There are also some genetic components to that where people can absolutely feel rested on that amount of sleep. That's an outlier, though, and I don't know the percentages, but I've met a couple in the military that were like that. Most of us aren't, and they are doing fine. but it's not the majority of us. And I would have to see what the latest research is on what are the genetic differences, because there are some different genetic and epigenetic changes that, just like eye color and everything else, but that make them not quite need as much sleep, and where some people absolutely need more than that.
Yeah.
So, right. So there are differences. So when I'm speaking in generalities as more of a public health.
Sure.
But that's a great question, because no, it's not just, there are some people that are trying to tough it out and look at sleep deprivation as a badge of honor.
Yes.
Certain business people type. Like, well, I'm not getting any sleep. I'm like, yeah, we'll see how that works for you long term.
Right. Okay.
But that's a great question.
Thank you.
Yeah. Well, I got to give you those pats on the back when,
I appreciate it.
So we talked about, I want to back up a little bit because we talked about melatonin a little bit earlier and I kind of glossed over it. So when you are, let's just say we're winding down in the evening time, we have no more blue light exposure via broad spectrum light. We start ramping up melatonin. You can think of melatonin as a gateway to enter that mode of regeneration recovery, which sleep is a part of.
When you say that there's no more of that blue light, the broad spectrum light, so at this point, the TV's off.
Yep.
You're not looking at your phone.
Yep. And your overheads. We're going to talk about that, how to kind of set that up.
Okay.
But let's look at the perfect example of that is like camping.
Okay.
Where people will naturally start to get sleepy. And what's happening is that firelight doesn't have enough blue light in the spectrum to inhibit melatonin. So as the sun goes down, blue light's out of the system. It's not shutting off melatonin anymore. So it opens up the gate, so to speak. So the pineal gland starts pumping melatonin out to prepare you for sleep. So by the time it reaches a certain level, you drift off very nicely into sleep and stay asleep.
Yeah.
So not only does it prepare the brain and body for sleep, it also signals the organ clocks. Remember I said the hypothalamus directs that? It signals them like, hey, we're moving towards away from activity mode and we're moving towards regeneration mode. So each organ, the kidneys, the heart, whatever, GI tract, they all kind of shift what they're doing. So we're not supporting activity right now. We're supporting regeneration. So all those processes kind of flip over. Okay. And that's really important because that has to take place. So if you're disrupting that and your signals from the outside say, hey, I'm getting bright light exposure. I'm, up and about, late night party or whatever. You're signaling the body it should be in regeneration mode or activity mode when you're basically messing up the natural system. Does that make sense?
Yeah, for sure.
And then in the morning when you get up, you're like, I want to hit a heavy workout in the morning, and you haven't given the body the signal to definitively cut off melatonin. You're basically, all your organ systems, including your muscles, are still in that regeneration mode, and you're wanting them to perform activity when the machinery isn't kind of been switched over.
Yeah, now your engine's misfiring.
Yeah. So you're wearing it a little bit. And that's and bringing back to your other question, Olivia, that's what's really happening. Like if someone has a really bad heart condition, and then they have a circadian rhythm disruption, like that small little hour change, you're basically messing with that whole system. Like in the morning, what do people say, right? In the morning, right? They'll have those heart attacks because the heart isn't prepared for activity mode. It still thinks it's in, according to the signals, still thinks it should be in regeneration rest mode. And you try to all of a sudden shove it into activity.
Yeah.
You see, that little bit of mismatch there puts a strain on it. And if you're already filled up where it just takes a little bit, that's when they have a heart attack.
Right.
I'm not saying a healthy person's going to have a heart attack. Right. But you get the idea, right? So it's a mismatch between them. And so also melatonin is really interesting. It's potent in its antioxidant ability, and it increases our body's own internal antioxidant defense systems. Remember we talked about oxidative stress a while ago, where that's one of the drivers of chronic disease. So you want systems in place to kind of deal with that. Melatonin, especially at nighttime when we're getting that is where that happens. It really kind of mitigates all that inflammation and oxidative stress.
Yeah.
So, and it's also the signal we talked about, the DNA repair.
Mm-hmm.
It's all in the cellular repair. It's also kind of the signal that kind of jumps that into place. So it's super, super important as a hormone. So anyway,
So with melatonin,
yeah,
I mean, there's a ton of supplements out there.
you're gonna go get me on a rant early. I have that one
might.
planned.
And maybe it's too early.
No.
Because we had a question about
Yes.
someone we know that melatonin supplements. Maybe Olivia can actually
Yeah.
bring it up. That they get headaches or something like that when they've taken melatonin, so they've kind of kicked taking any sort of supplement.
I thought they were talking about magnesium at that point.
Or was that magnesium?
Well, actually, they do get headaches from melatonin too.
Yeah.
So I'm not really sure what to make of that, but I will. If we're talking about melatonin supplementation,
Yeah.
I have a rant
Okay.
pre-prepared.
Okay. You want to do that now?
Why not?
or-
We're talking about melatonin.
Yeah, I think you probably should. I'm going to say you need to take the glasses off again. Maybe get a couple push-ups in. Maybe take
All
your
right.
shirt off, and then let's go. Take a sip of water.
I'm gonna take a little sip and get
Yeah,
prepared.
and then slurp it.
There we go. Gotta get prepared.
Good. Now just let it breathe on me, bro.
So, melatonin is very interesting. When the pineal gland secretes it, when the hypothalamus, we don't have that inhibitory thing on it anymore from the blue light, it pumps it out in a pulsatile manner. In other words, it's not constant stream, about every 30, 40 minutes. And in melatonin itself has a very short half-life. Are you familiar with the concept of half-life is?
How it's like shelf life,
Kind of, yeah. So
how long it lasts.
if I take a medication, how long it lasts, and half-life means really how long it takes for half of that we use it in pharmacology and toxicology all the time. How long it takes to process half of that and get it out of our system. Okay. So the half-life of melatonin is very short. It gets chewed up. It has its action, then it gets chewed up very quickly, and then the pineal gland secretes more during the night until it's been told to turn off by bright light or any other disrupting thing. Okay. So, and it's the actual amounts of melatonin are relatively small that the pineal gland is secreting to do that. When you take one of these over-the-counter supplements, those are what we call supraphysiologic doses. In other words, doses that you would never see internally ever. They're very high. Even the ones that they're like, advertised as low are still much higher than you'd see in the body. And what happens is people are like, oh, it helps me go to sleep. Well, I'm sure it does. But what they're doing is they're taking in melatonin from the outside. Whatever they take gets chewed up pretty quickly because melatonin, our systems in our body to move things along, chewed up pretty quickly. And then that big dose suppresses the natural melatonin secretion the pineal gland does. So basically people will say, well, I'll take it, I'll fall asleep, and then I'll wake up. Okay. And then they have a hard time going back to sleep, many of them, because there is a suppression of your body's own internal melatonin system. Does that make sense?
Yeah.
I typically only use that stuff when I'm traveling and there's a significant time change to maybe help adjust me to kind of give it a little reset.
Sure.
But that's kind of the only, I never take that stuff long term.
Melatonin.
Yeah. What we want to do is get our body to optimize its own production. And we're going to talk about that via light.
I've heard for older people that it might be good to supplement because production goes down as you get older.
It does go down. The problem is, unless you, and I haven't kept up with it, but unless there's a long-acting, slow-release melatonin supplement, you're going to run into the same problem. Is you're not going to mimic the body's physiologic, how it normally produces melatonin,
Right.
and you're going to get front-loaded with a melatonin dose. Unless it's a very slow, sustained release, it's going to be a problem. So that's very true, Olivia. But it doesn't mean that that's helping them unless we have a very, a studied, slow release formula that will try to mimic.
Yeah.
Because you can't wake up every 30, 40 minutes to pop a little tiny piece of melatonin, right?
Right.
that defeats the purpose? That's a really, really good question. It's a real problem because, like you said, sleep in older people is really disrupted. And as we age, I can speak for myself, I really have to have that stuff dialed to really optimize my normal circadian system.
Okay.
That's a great question too. So what happens when we don't sleep or we have a mismatch in our circadian system? The classic example is a shift worker, okay, where they're trying to work activity mode when really the light system all around them, the sun, tells them they should be sleeping. Okay.
Yeah.
It's a tough problem. So I'm going to go through a couple of them, of what happens to the individual organ clocks with that.
This is really, I mean, jiu-jitsu world, we have a lot of law enforcement, firefighters,
Absolutely.
paramedics.
Matter of fact, in my medical specialty, I work with a lot of them.
Okay. And then obviously being in the Northwest, or specifically Everett, we have Boeing is very prominent.
Yeah, any of the shift work, absolutely. And I will tell you how profound this is. Remind me, after I talk about these remind me to tell you a specific case, a couple of them I've encountered in my clinic.
As long as you tell me their names and birthdays.
No, absolutely not. So again, like if you look at the adrenals, you know, you may have your cortisol timing is going to be off. You know, we're using these clocks to regulate all these secretions. And so like if you have, for instance, if your cortisol is then high at nighttime instead of early morning, it's stimulatory and you have a hard time falling asleep. It's the same reason why people are, you know, they come in from a real heavy workout at night, which guess what? We do. Sometimes they can have a hard time falling asleep. Or people are on prednisone. I think we've talked about this before, where prednisone is basically an analog to cortisol. It's just basically a pharmaceutical version having the same action that cortisol has. One of the primary side effects of it is insomnia.
Okay. I'm not going to interrupt you, but
No.
Olivia, remind me to ask about, we have a couple training partners that intentionally train in the daytime because if they train at night, they cannot get to sleep.
That's right.
And they have to be up at 6 a.m. or something like that.
Yep.
So I want to talk about them in a second.
I think that's, that's a really important point.
But keep going.
Again, we started talking about when you talked about that time change and heart attacks. Again, like I talked about, if the heart still thinks it should be in regeneration mode and you're wanting it to do activity, it's not really prepped for it. The liver, the same thing. What we found is the liver then starts mishandling meals. Like if you're working third shift or night shift, and you're eating at a time where it's a mismatch between what the body thinks it should be doing with these things. It's like it's not really equipped to handle big inputs of food when we're switched over into that kind of
Let alone throwing in garbage food.
Yeah. Now, the caveat to that is, to some extent, the organ clocks can be entrained by themselves a little bit, but it's still a mismatch to the master conductor, the hypothalamus, where what the body thinks should be happening. And because of that, the liver is really important. Liver and pancreas, you talk about shift work is a big predisposition to diabetes. And this is a perfect example. Like I've had a couple patients that were third shift workers, and one had actual type 2 diabetes and the other one had pre-diabetes. Both of those folks were able to get onto a day shift, and they did no other changes, and they were both no longer diabetic.
Interesting.
Because of the stress of the circadian disruption, and when we're trying to make all these systems work when they're not supposed to.
How long, if you remember, each case?
A couple months, man.
Really?
It was drastic. Because all that, remember that stress response and all that will drive insulin resistance and mishandling glucose, the whole 9 yards. I mean, there's studies that show healthy people with sleep deprivation just for a couple days will have insulin resistance bumped up to the pre-diabetic state.
So, I mean, I think we had a little bit of that with Olivia, right?
Oh, I think so.
Yeah, where her sleep was garbage. She tests her glucose multiple times a day.
What was it high? Then you're saying, Olivia, your glucose is higher than you normally see it?
It was when I was working, yeah.
Yeah. So this is a perfect point. And it's really bad for you. I mean, shift work is considered a cancer-causing agent by the World Health Organization itself. It is a human carcinogen, and so it's a huge deal. It's such wear and tear on the body because all these systems in your body are trying to follow a light-dark cycle that the sun creates, and when the cues are not there, for instance, at night, if they're not getting their melatonin secretion, and then during the daytime when they try to go to sleep, it's really hard to block out all the light completely, like driving home from work and the whole 9 yards. And they're constantly in this kind of mismatch. And that kind of drives I hate, not a medical term, but kind of wear and tear on the organs. They're not functioning correctly. And then it's shift work and circadian disruption in general has been linked to, we've talked about cancer, increased risk of heart disease, diabetes, high blood pressure, autoimmune disease, depression.
So is that one of the things when someone's coming in and they look, they're not obese or anything like that, and they're pre-diabetic? Is that one of the first things?
Well, we always talk, and when I don't do primary care anymore, but when like when I was working doing some integrative medicine, lifestyle medicine, we always go through all of these big things, and sleep is a cornerstone of this. Stress and sleep. It's exactly right. Well, what we'll ask. It's not the only thing, but it definitely.
But it's something that's absolutely going to get touched
for sure, and we have to.
And if your doctor's not, you might want to look at a switch.
Well, yeah, I know. See, but that's the problem. That we could go into a whole topic and whole podcast about what's wrong with modern medicine. And
we will.
The problem is, just really quickly, is we have a lot of good doctors, highly educated, that really want to do good stuff. And they're in a system that makes them see a patient every 15 minutes. And basically just trying to get through the day is like making sure their medications are managed. I mean, they don't have, like Carrie's clinic, she, her intake is an hour where she gets to know,
Yeah.
And that's the only way you can do this type of good medicine and preventive medicine, and to figure out what is driving that. Because I could sit here and just manage your medications, Bill.
Yeah.
And look at your blood work and like, hey, you need to do better. And it's like, I don't know. Hey, Bill, how are you sleeping, man? And what's your stress level? You know what I mean? And really get into that.
I remember one of the first times, maybe it was the second time, not my first intake, but the second time when I started using Carrie as
seeing Carrie.
Yeah, primary. And I think we had like a 45-minute block set out, a time, and the whole time was with her.
Yeah.
Which one is like weird.
Yeah.
And two, it was kind of like, she's asking me questions, and like at first I'm a little reserved, and I'm like, yeah, things are fine, But then when you have that kind of time with the physician, you start to get comfortable to be like, well, actually
this is
yeah,
exactly.
I bleed when I go potty, something like that.
There could be, and that's how we all should be able to do it. The system is set up for failure right now. It's basically set up for disease management right now.
Yeah.
And not really truly, we preach prevention and all that, but it's not really set up for that. And you don't get reimbursed for prevention. And anyway, I don't want to delve on that, but we can get back to the sleep and circadian rhythm. But it's really nice when someone is delving it, because this is such a huge topic and such an important one because of all these things. This is a big driver of chronic disease.
Yeah.
Right. So let me see if I had anything I wanted to talk about.
And I also can jump back to those guys that.
Yeah. Let's before we get into actually fixing the problem, we're trying to optimize it. Yeah. Let's talk about that a little bit. So give me.
So there's a couple of guys that train in our gym that they want to train at night.
Yep.
They have the ability to train at night, as in the schedule, but they don't because if they train at night, they will not go to sleep.
Yep.
Like they struggle to go to sleep, and then they have poor night's sleep. One's runs a large business, so he has a lot of people depending on him. So he will be at work that next day, and he wants to be at his best. So they train only twice a week, maybe sometimes 3 times, because Saturday is a morning class. And, they're kind of limited to that amount.
Yeah.
And if there's a day that they can't make that, then that's just a day they can't train. And it really, it's frustrating for them. What is something in that scenario that they could do?
We'll talk about that here.
Yeah.
So first of all, let's just be honest here. A midday training or an afternoon training session is much more optimal.
It always feels better.
Much better. But the reality is most of us, because of jobs or whatever, and just, when classes are offered when most people can go to them.
Yeah.
I mean, that's, it's not that like the academies are like, no, we're only training at night. It's because most people can go to that.
Yeah.
That's not optimal. It just isn't. And so basically what we're trying to do, and I'll talk about some things I do, is trying to work around something that's just not optimal.
Yeah.
I mean, what's interesting in those organ systems, the muscular system and everything that supports that, can somewhat be kind of entrained by a repetitive input. Like, okay, I know the body gets used to doing something at a certain time and it will adjust to a certain amount, but it's not optimum. So the people that are doing that during the day, it's much better if you could do that. The reality is, like I said, most of us don't. So it does no good for me to say, well, you guys shouldn't be training at night, because I would never be able to train.
Right.
And so we have to. And so we'll talk about some things we can do to kind of mitigate that a little bit. But yeah, it's super frustrating.
But the beginning of that process would be pretty tough on them.
It'd be and certain and maybe with some of the things we're going to talk about, they could try it again. But some people, I mean, everyone's an individual. He or she may not be able to do it,
especially as they get later in life.
Yes,
So,
exactly.
I know one of them is right around my age, and he's late 30s.
Yeah, and I'll tell you, over 50. I have to have that stuff dialed in because it's really hard. Okay. But that's a really good topic, and so
I think a lot of people deal with that too.
To some extent, yes, we do.
Or they limit the amount of days that they go training because they just know they're.
I probably could train 4 days a week instead of 3 days a week if I could train midday.
Yeah,
I probably could.
Yeah,
but. Whatever. I mean, it doesn't matter what we would like and what would be our utopia. It's not the reality right now. Yeah. But if people are able to do that, train midday, and can get everything they're wanting out of it, that's much, much better.
Yeah.
So anyway. Yep. So what do we do, basically? Some of the things, the biggest thing is the light thing. Okay. So if you think about how most of us live, let's kind of talk about this. Especially in the Northwest, especially in the wintertime, most of us are getting up and going to work when it's basically dark outside still, right? And we're basically going to work and trying to get our brain functioning when our system is still secreting melatonin and like, what's up, dummy? Why are you trying to do activity when we're still supposed to be sleeping? As far as the light, as far as the triggers from the outside are concerned, we're still secreting melatonin and we're not shutting that off. So we're kind of in this weird state where that's why everyone's so groggy driving to work, and we're using stimulants basically to kind of get us moving.
Right. To get us down and to get us moving.
Then people feel better typically as the morning wears on. They get natural light exposure starts coming in and all that. The problem is most of us don't live in these definitive light and dark cycles. We live in there's a great book, I forgot the name of it, about sleep. And they said most of us live a twilight existence.
Do you know who?
I'm going to look into it. We can probably post it in the show notes.
Try Googling that.
It might even be in here.
What was it?
A twilight existence. I bet you I can.
Twilight.
Yeah, so
Is that your book?
No, it's not my book.
You had your own book on hand.
No, I do have my own book on hand. But anyway, I can look through it, and we can.
It's fine.
But I think I actually referenced.
If she
that.
finds it, she'll bring it up. But.
So because of that, we're not getting a definitive on-off signal.
Yeah.
We're not getting an off signal to turn off melatonin in the morning definitively. And at night, we're not getting an on signal very well because we still have this artificial light coming in, low levels of blue light. We're not getting that melatonin ramp up that we want. And we're surprised, when we finish reading or watching TV before bed and we shut the lights off that we can't go to sleep. Because now melatonin now has to ramp up. Does that make sense?
Yeah.
And so a couple things. What my wife and I started doing, especially, this is really important, especially as you get older and your stress cup is not as big anyway, and you can't really, do well with, we try to optimize everything. So we try to simulate like a camping type thing. So let's say, Bill, you guys want to go to bed at 10. That's your goal. So 2 to 3 hours before that, let's just say 7.
Okay.
Ideally, you would want to turn off any bright light or especially bright, broad spectrum light exposures. And that's where, if we can, Olivia, I don't know if you can show the front of the,
Just do the one facing.
Yeah, or my own right here. So this is what's commonly known as a bug light. You can get them from like Home Depot or whatever.
Yeah.
Whatever store you can find them, Amazon, whatever. But this looks like an yellowish orange bulb. And it does not emit blue light in the blue spectrum. It more mimics like a campfire or something like that. So people call them bug lights. You ever figure out why? Ever wonder why they call them bug lights?
I remember those zapper ones that were like blue though.
Well, they're attracting them just to kill them.
Okay.
So bugs are attracted to blue. Many bugs use blue light in their spectrum for a navigational aid.
Okay.
And so bug lights don't keep bugs away. They just don't attract them. Does that make sense?
Okay, yeah.
So
So if you got those on your porch, let's say, you're not going to have...
It's not going to attract them.
Because sometimes, like, you'll see on your porch, like...
They'll circle.
They're just all around.
Well, because they're using it as a navigational aid. They're sensing into that blue light spectrum. And I'm not an entomologist, so, there's certain... Maybe someone says, oh, this species doesn't do it. Whatever. Anyway, the ones you see circling around the light absolutely are attracted to it. Again, this doesn't repel them. It just doesn't attract them.
And that's why they call it a bug light.
That's why they call it a bug light. People think it repels bugs. It doesn't. It just doesn't attract them.
Okay.
So, and those savages with the bug zappers are actually
terrible
people.
Murderers.
They're attracting them with these blue lights, and then they're zapping them.
My mom is a killer.
I would say people, if you want to do an experiment, replace it with these things and see how it works.
Okay.
Anyway, so
that's one.
Well, yeah, and what you would do, because we still, let's be honest, we're just not going to go to bed at 7 o'clock.
I'm just finishing situationals at that time.
Well, and that's different for training nights. We're going to talk about that in a second.
Okay.
So it's not going to work quite as well. But we still are going to do the best we can with it. Whenever you can, as close within that window, if you can shut off those overhead lights.
Okay.
And what we have at home is we've replaced lamps where we'll turn off on the lamps with these things in there. And so then we won't have that blue light input, and then we'll start ramping up our melatonin. Okay. Allowing then when we do go to sleep, and oh, by the way, when we read before bed, I got these things in too.
Right.
We'll actually have a good melatonin level. So when I do go to sleep, I'm already at that level that allows a transition to sleep instead of sitting there.
So you're trying to 7, 8 o'clock. You're trying to have that.
Yeah, because we're trying to get the body prepped for regeneration mode, and melatonin is the thing that brings us into that.
Okay, and if you're working on a computer or you're doing something on the phone, are you using the little this thing here I got? So,
I know exactly what you're talking about.
So if this is like my normal screen.
Yep.
And then we'll do, so we have that, and then
Yep, exactly. So what you've just done there is change your spectrum,
yeah,
your color temperature down to more of this.
I call it eye comfort shield on the Samsung.
Well, yeah, and
But
you can
you really notice it more so when it's
you sure do.
it's using it,
Yep.
and then when I turn it off,
You really notice
really
the
notice the
change. And that's exactly the point. So if you have the ability, especially on your smart devices or tablets, there's or your computer, most of them now in their operating systems will have an ability to do that. There
Yeah.
used to be a program called Flux that you load,
okay,
and you can set it for a certain time, and all of a sudden, without
Black
you doing
and white or
anything,
something.
it will just move over to that spectrum.
yeah, you can do timers and all.
Yeah,
that
exactly. So if you're on those, yeah, absolutely. And then that way you're not getting that broad spectrum light. Now, big TVs are different. Or let's say you're in a situation with a roommate that's not digging this whole bug light thing.
It's a little too intimate.
Yeah, it's like, or just like, I don't know, it's just being stubborn, like, no, I don't want that.
Right,
You know?
right.
So that's when we have these things. And Olivia,
'em
I'll
on.
hold them up. Yeah, I'm going to change my glasses here.
I got a pair of those.
Yeah.
Olivia's been wearing them.
So
It's true. You never wear them.
so these things, you can get them for like $6 or $7.
Yeah.
They're just amber colored safety glasses.
Oh, okay. I think the ones we have are like meant for this,
I'm
but
sure
the
it's-
Yeah, they can advertise them whatever they want.
Right,
They're,
it's the same
they're
thing.
going to upcharge you for the same thing.
Right.
You can just get the safety
I
glasses.
spent $150 on those.
No, we did not.
But put it this way, less than $10.
Wow. Okay.
Okay. And then, so you might look like a nerd or goofy, but whatever. So if you can sit around like at 7 o'clock, let's say you're watching TV, throw some of these on.
Yeah.
If you don't have the ability to change the lights and all
Right.
that. And it's pretty darn good as long as you get a wrap around here, so we're not
Okay,
getting it
yeah.
from the side, but
Only your cat's gonna, or your dog's gonna think you're looking nerdy, right?
for sure, and they do anyway. But yeah,
Okay.
and I also, when I have back to your question earlier when we talk about,
Would you ever double up?
so that's a good. I don't think there's really a need unless you
Okay.
have any, because what are you then blocking if that's really your only light source?
Are these pretty good though? Like
They're pretty good.
Okay.
They're pretty good. They're not perfect, but they're
Sure.
much better.
Especially maybe if you're doing that and this, if you're looking at your cell phone,
Definitely.
because I'm sure this little feature is not perfect.
Well, it's not bad though.
right, not bad, but I'm saying that.
Yeah, for sure.
Yeah.
If you want to cover your bases, I've used these a lot, especially with police officers and firefighters. Let's say they work a night shift and they're trying to drive. So they get off their shift and we're like, okay, we have to work the best we can to simulate a natural circadian rhythm for them. It's super hard, and it's not a perfect replacement, but it's better than not. So the idea would be they'd get off their shift, and let's say as soon as they plan on going to bed, whenever that time is, whatever that 2 to 3 hours is,
Yeah.
I even have them throw on a pair of these on their drive home so they can start
Or when they're doing paperwork
or whatever.
and
So,
the shift,
so they can start ramping up that
Yeah.
melatonin secretion, and then they get into a room. Hopefully, they have their room blacked out.
Right.
Okay, that will help. It'll help them ramp up their melatonin naturally, and especially if they are in a really darkened room where they're not getting ambient light in,
Yeah.
then we're basically kind of faking out. We're
Yeah.
putting them in their own little ecosystem, basically.
Okay.
And then conversely, though, for all of us,
We get those bad.
yeah, you can check them out. So, kind of back to, so that's the first part of it. That is just to make sure we have melatonin secretion to get us ready for bed.
Okay.
Okay?
Yeah.
But in the morning, we want to cut that sucker off immediately. And so that's why bright light exposure first thing in the morning is really important, because that will definitively stop regeneration mode, so to speak, and get the body back into activity mode because melatonin has stopped that signaling.
So we had a flooding issue
I remember.
in our house. Yeah.
Yes.
And it made us have to our master bedroom is
Yep.
on it's facing, the windows are facing east.
Mm-hmm.
And we had to stay in one of the spare rooms, which is facing west.
Mm-hmm.
Right. And on the master room, like we have our blinds down completely and it's very dark. So we don't get any light until we actually open the blinds.
Right.
On the west side bedroom, we don't have those kind of blockout blinds that block everything. It's just the normal shades kind of thing. But we noticed that on weekends when we don't have a clock to wake up to, it can naturally wake up, that the light just naturally starts coming in.
Yep.
But it's not direct like the sun like blasting.
It doesn't have to be.
It's just if it's a nice, like a clearer day.
Yeah.
The natural wake up from the light it just feels so good.
Well, and that's because you're not struggling with residual melatonin.
Yeah.
Because, melatonin tells your body, I need to be resting in, I need to shut everything down. And so when that turns off, then we're waking, it's a natural waking thing. It basically, and it sets your circadian rhythm too. So if you can get a bright light, they call them, you've probably seen mood lights and stuff like that. They sell them a lot.
I got a mood ring, yeah.
People with like seasonal affective disorder.
Yep.
Where they have the winter blues, so to speak, especially up here in Seattle area. You definitely want that in the morning, a good 30 minutes of bright light exposure to shut that melatonin secretion off as much as you can. Matter of fact, at my desk at work, I even have a little emitter where I'm getting strong ambient light, and I'll turn it off after a couple hours in the morning just to make sure I'm getting a good signal. And when you do that, it really gives a good signal for then it sets, you're like, okay, boom, I just set activity mode at 7 o'clock in the morning.
Yeah.
Now, do the natural circadian rhythm, especially if you're using the stuff to inhibit blue light when it's supposed to be, you're going to fall into a normal rhythm that your body's supposed to operate under to allow all these things like sleep, wake, and you'll find you'll probably need to use less caffeine, and all those other kind of, things we do to kind of stimulate us.
Right. Gotcha.
Yeah. So that's the light piece of this. So I found that, especially getting older, just part of it, whatever, but I have to really dial stuff in even further. And so what we started doing a couple years ago, and let me tell you, Carrie gave me the side eye, like, really? You're getting this? And then she was sold. After a week, she goes, okay, that's legit. We got, you may have heard, I'm not advertising a specific one, but the one I have is made by the makers of Chili Pad. It's called the Ooler, O-O-L-E-R.
Okay.
What it is a thing that goes on, it's a very thin pad that goes on top of your bed. And it's connected. In our case, we got the one that's divided in half, where it has these tiny circulating capillaries that carry water through this pad. And it's hooked up to 2 individual units, one at the foot of my side of the bed, and one at the foot of where Carrie is on a queen-size bed. And you set it to a certain temperature at night. Like mine turns on at 8 o'clock at night, so it's already at a certain temperature. And I have it set to cool me to what it does when you lay on it. Water is a very good conductor of heat. So it pulls away sometimes, even if the room is warmer than it should be. Because we always hear people say, oh, you want your room cold, right, at night. But even if the room is not, like sometimes in the summertime, it pulls heat away and circulates it back through the capillaries, back into a tube, and then it cools the water down and circulates it back through again. Okay. And you can put it, he has a little app on your smartphone that will help that natural circadian drop of body temperature. It kind of supports that natural circadian rhythm of where body temperature drops and gets to its lowest point early in the morning. Then I have it set off, especially on the weekends, to turn off. And it's amazing when that temperature comes back up, it's a natural waking thing. All of a sudden I'm like, oh, and it will wake you up without even an alarm clock. Because the temperature then goes back up as it's supposed to with your circadian rhythm.
I'm going to assume,
Yeah.
while you explain this,
Yeah.
Olivia purchased one on the computer.
Pretty sure I told you about that Sleep 8. Which
That's another one. I haven't tried that, but it's a similar thing.
It sounds familiar that Olivia might have.
Well, yeah, it also will vibrate your back. Like,
Isn't it like
if you want an alarm.
$200?
The Ooler's more expensive.
Okay.
No, it's like $2,000.
The Ooler's
No,
about
I don't know about that.
the
but
Ooler for a
Sleep.
king size. Last time I a queen size with 2 units is roughly about $1,000. It might be more.
That was why I struck you down.
So I don't know about.
But $1,000 is a lot better than $2,000.
No, that's way better.
I don't know about the other. You have to look at the current pricing and all that.
Yeah,
We've had ours for about 2.5 years now.
I mean, that was about when I think she brought it
And
up.
and
You guys probably talked about it. I bet you got it, and then she.
Well, another one of my buddies who's a doc at the clinic I work at was like, I talked enough about it, and he finally was like, all right, fine.
Yeah.
He goes, oh, game changer.
Okay.
Yeah.
So you got 2 I told you so's.
And so for me, it made a huge difference in my sleep quality because I felt it was it was supporting my natural circadian rhythm of getting my body temperature low. And I do some interesting things too
But combining that with the light stuff.
for sure.
Okay.
Also, and I don't know how much science is behind what I'm going to tell you next, but I can just tell you what I've found. I take a hot bath at night. And it sounds counterintuitive. Like, I thought you wanted your body temperature to drop.
Epsom salt?
It doesn't matter.
Okay.
It doesn't matter just the heat itself.
Okay.
And when you get into hot water, you notice your skin turns red.
I haven't noticed because I haven't taken a bath in 30 years.
You need to start doing that. Or a hot shower, you don't notice that your skin is, okay.
Okay. I feel like I don't notice, but I take really hot showers. So
So you can really tell, like, if a piece of your body is what's in it, like if your part of your foot's in and out, you can see like it's red.
Okay,
here.
yeah.
So its capillaries are really opening up and trying to dissipate heat.
Okay.
And so the idea behind it is, and I've found it pretty effective, is I'll take that hot bath specifically because I can submerge my whole body. And when I get out, I feel real warm, but my body is now starting to, it's in a mode of dispersing heat.
Which is the weight.
Yeah.
People, when they're cutting weight for wrestling or MMA, whatever it is, they'll jump in a sauna.
Yeah.
Then Mikey Musumeci did this, and he would jump out.
Yeah.
And then they were squeegeeing him.
Yeah.
And they squeegeed him right when he got out. 3 minutes later, he was drenched again. So they squeegeed him again.
Yeah.
And he said this last Worlds that made a huge difference on his weight cutting.
Well, it's trying to, in the sweating is what that is. It's trying to disperse heat too.
Okay. You're using that as a way to open up everything. So
The capillaries to disperse heat more. And then I look at that as jump starting a cooling mechanism.
Okay.
That makes sense. And then I get into bed with that that's already in, and it's pulling that heat away. My capillaries are more are in that
Is
mode.
it chilly when you get in there? You're like, woo.
Feels pretty good.
Okay.
Yeah. And then what we do now in the morning is Carrie and I do a cold plunge.
Watch your mouth.
I know. Oh, I had to. What's funny is I had to talk her into it.
I can't even think about doing
cold. I will be honest with you. It's horrifying when you wake up in the morning and you're nice warm in bed. I almost curse to myself when I think about getting down because we have it set at like 54 degrees.
Yeah.
And so we get in that thing, but it has a lot of good benefits. But one of the things it does is it also kind of bookmarks. Okay, here's the other end. I did a hot bath at night to allow cooling to take place. Now I'm getting a stimulus to the body of cold, so it's helping it try to warm itself up.
Yeah.
So I'm trying to support jump-starting that rhythm and kind of like making those definitive, like just like morning light, now I get a cold water exposure, right?
Dude, I'm so fragile. If my shower is not steaming and I stick my hand in it, I'm pissed.
Well, I'll tell you this. When Carrie was doing it at first, she was like, I am not getting in that cold water. I'll have her when she comes on, I'll have her. But now she craves it because she feels so good.
She's a savage.
I'm just telling you.
I know Olivia did it for a little bit, right? Like you were doing little in the shower.
Was it a shower?
A couple shots.
I think I did it twice, and the second time I didn't breathe properly, and I had like back pain for the rest of the day.
Because you tensed up.
Oh,
The full immersion's a whole nother deal.
No, I can
So
imagine.
you ramp up first with the shower, right? And then you go from, but I'm just saying, if you want to optimize this stuff,
Yes.
I'm not saying everyone should get a cold plunge and all that, but It has a lot of other benefits too, but it's really helped me because I feel like I'm really dialed in my circadian rhythm, especially in the wintertime when the light is all wonky here in the Northwest. So
is there a way you can do or something similar without doing that in the morning?
So you want your cake
And
without getting fat,
I want to eat it,
but you don't want the
and
consequences.
I want riblets. So yeah, is there anything to help wake you up or shock you
The
besides cocaña?
the light is you just use the light as your entrainment.
One of those
Yeah.
light.
Yeah, the broad spectrum light.
yeah.
Sunlight's the best, but obviously when we wake up here in the Northwest, we don't have it in the wintertime.
But I mean, even if it's cloudy, you can still.
Yeah, it's still, believe it or not, even on a cloudy day,
you're
compared to
still
what an
getting stuff.
office is, it's still brighter.
It's
right?
just if you're getting up at nighttime.
Exactly. You'd want to stimulate that. At your beginning of your waking cycle in your activity mode, you want to stimulate the cut off melatonin, basically.
Okay.
So playing with that has helped a lot of people because now we're optimizing these sleep things. And maybe people have sleep disorders that have nothing to do with this. But surprising amount of people, when we've optimized this, have had a much better time sleeping.
Yeah.
It makes sense, right?
Yeah,
Because
for
we're
sure.
actually supporting our body systems, and I'm all about that.
Without supplements, just
Yeah.
naturally.
So it's terrible. Like I'm gonna have bright light exposure, and I'm gonna have caffeine after noontime, and now I'm pissed because I can't sleep, so I'm gonna throw down some melatonin. I mean,
Right.
we're not really doing any good that way, you know.
Right.
So, but that's kind of some of the main things I do for sleep. Now, late night jujitsu.
Yeah.
Okay. Not optimum. Okay. For many reasons. But there is some kind of circadian adaptation over time where your body says, okay, this fool's doing this, so we better just figure it out.
Yeah.
But as far as kind of calming, like back to your question earlier, where you said, hey, I have this guy that just can't, he can't train there because he can't go to sleep.
Yeah.
He's wired. That is when things we can do both. Obviously, as soon as you get home, you'd want to get bright light exposure off. Okay. As soon as possible. You want to get into this kind of
routine
mode right away. And it might not be, you're like, well, I still want to go to bed at 10, but I got home at 8:30. Do the best you can.
Yeah.
Just as soon as you get home, switch over modes. Even if it's not the full 2 to 3 hours, right? Also, make sure you refeed. The biggest thing people make, and it interrupts their sleep, is they don't get a good refeeding after even though people say, as we talked last time, people say don't eat after whatever. I'm like, yeah, you're not grappling for 2 hours either.
Right.
Okay. We have to refeed. That will help prevent.
Is there something, or is the refeeding, when related to sleep, just you can refer to what we've already gone over?
That's correct.
Get your good
Protein
carbs.
and carbohydrate, because otherwise your body's going to be like, okay, fool, now we got to create some blood sugar for the brain, so we're going to secrete cortisol, which then helps keep people up, right?
Okay.
So, addition to that, what I have used is some supplements that seem to help.
Okay.
The kind of concoction I use is magnesium threonate, otherwise known as Neuromag. It's a special type of magnesium. It seems to penetrate the blood-brain barrier better. Helps create a relaxation response. There's all kinds.
N-E-R-O.
Neuro.
Okay.
Mag. It's one of the brands, but it's magnesium threonate. Threonate. I use that, and it's a powder. I mix that, and I do some chamomile extract, not just chamomile tea, but actual extract from the plant. It also kind of helps calm the nervous system. And then the last one I think helps a ton is called L-theanine, not threonate, but theanine. So
L-theanine.
L-theanine. It's really interesting. It's present naturally in tea, especially green tea. In general, this is a gross oversimplification, but there are two main functions of the nervous system. Nervous system works a lot on stimulation and inhibition. Okay. I'm not going to get too much into that, but one of the stimulatory neurotransmitters is called glutamate. It's one of the ones that kind of excites the brain, gets it, when you're stimulated. L-theanine is it's a similar structure. And what it seems to do is inhibit that kind of excitatory stimulus in the brain and more into that inhibitory kind of settling down. It's like a relaxing type of thing. So the combo of L-theanine, magnesium threonate, and chamomile has really helped me. And I think if I remember right, I kind of got that little combo from Andrew Huberman, from his Huberman lab. He's a neuroscientist at Stanford.
He's got a good podcast.
It's a great podcast. I encourage everyone to listen to it. It's really, really...
I know we have L-theanine and the Neuromag both in pill form, and they're part of...
I like the powder form with with magnesium, because I just put a little water into it. Chamomiles, people have used chamomile tea to relax at night for many years, but this is a concentrated extract you can get in a little bottle, squirt, and you squirt a couple in, and then swirl it around with the magnesium, drink it, and then take a L-theanine.
Got it.
That seems to help. So someone like the guy you're talking about could play with that a little bit, get a good refeed, and take that and try his best to get the light thing under control, and see if that worked. And if it doesn't, you can at least try. Yeah. Like I said, we're dealing with a kind of a challenging situation here. And, I'm not going to stop training at night, because that's the only time I can train.
Right. Yeah, he comes on his lunch break for a sharp hour and 12 minutes.
Which is good for him, because I think and I understand
one
what
of them does. Yeah.
What he's actually getting, that's ideal. Okay. But there is that also kind of, the night classes tend to be bigger. There's, that camaraderie
which is the other guy, when he's in town, he lives in Snoqualmie. So he just kind of suffers and does the drive and
Yeah. So but ideally they're actually doing it correctly.
Yeah.
But again, we're in it. I'm always on the lookout for new ways to optimize this.
Sure.
But those things I talked about, I think, is a starting point for anybody that's having trouble sleeping. And then there's other things that you'd have to talk to. Like Carrie works with a lot of people and checks out, hormone levels and different things, that a deeper dive into people who are still having problems. But start with this stuff.
It'd be cool if anybody does try this stuff. Let us know. Just shoot us whether it's an email or a message on Instagram, Facebook,
or
whatever.
Something they found that really helped them.
Yeah.
So they can share with everybody.
For sure.
And then, I can look into it and tell you my 2 cents on it. And, I think that's all great.
I'll give you my 2 cents.
Huh?
I'll give you my 2 cents.
Well, I think that's great. We might have a nickel between us. Maybe.
Look at you.
I know.
This is like an old man joke.
Dude, it's appropriate. It's an age-appropriate joke. But, that's kind of what I wanted to talk about here with this stuff, and just kind of give you guys an overview of how it actually works. So we know what we're doing and why I'm kind of recommending certain things.
Well, do you want to go into a couple questions?
Yeah, we might as well.
Farmed. Olivia, I think you have.
Not necessarily related to this.
Yeah, not necessarily. There's, I think, one. We'll start with that one.
Okay.
And then we can go into a couple others that we have.
Before we do,
yeah,
I know I'm putting a lot of work on you, but I really want to see my narrated role where I get kind of messed up.
Oh, with Gian.
By a young and very
young,
good purple belt.
Athletic, very handsome, very full head of hair. Purple belt.
Yeah.
I've been off my game this week. I didn't do any of the commentated roles, and
it's okay.
I will make that the one when we edit this.
Yeah.
Olivia, I just haven't felt funny lately. And I feel like I need to be in a little bit of the mood,
Well, especially when you really want to. There's a lot of material here to work with.
I've recorded it twice, and it was both an hour long. So, and the roll is 5 minutes. But I think that is Frontline next one that's coming out.
You made me happy,
and I'll post it everywhere.
You may proceed, sir, with the question.
Livy.
Yes.
What you got?
Okay, so first one is how or can childhood trauma that would occur at nighttime affect your sleep?
If the trauma happened at nighttime
Correct.
and they feel like
It's affecting their
that's
sleep.
definitely what's affecting the sleep. Okay.
So
Or a
it
factor.
sounds like a PTSD type of thing.
Yeah.
So for sure, and especially if people have an association with nighttime and trauma, that's a real issue, right? And but it doesn't take the trauma doesn't have to take place at nighttime to affect your sleep, because what happens is, I saw this a lot in the military. People.
Yeah, because it's not necessarily just childhood. It could.
Yeah.
It's just for this person that's their form PTSD, but it could be a bunch of different PTSDs can affect.
Yeah, absolutely.
Or like military, they're getting bombed at night or something like that.
Yeah, and it doesn't have to be like it doesn't have to happen at night, but when we do lay down at night, during the day we have all these competing stimuli, right? To both from sight, smell, sound, activity. The brain's getting bombarded kind of with all these sensory inputs. When we kind of lay down at night, all that kind of input calms down, and then that's when those thoughts start racing usually, and people get stuck, and the brain is just, you start getting into those little loops. We've all been there where it's just like you can't turn your brain off.
Yeah, I feel like if I'm not actively listening to something or watching something, like typically I watch jiu-jitsu in bed, or I'll listen. It's usually just watch jiu-jitsu, but I might listen to like Lex Friedman or something and if I'm not doing that, or when I shut it off, I can quickly go into like this kind of self-deprecating kind of position.
For sure. And it's because of that. We don't have a competing input.
Yeah.
I read at night for a lot of the same reasons, and it helps me, something completely non-technical, something. Yeah. So I would say this too. Obviously, that's something that would have to be, by a mental health professional, would be really good to work with. But all these things can help. At least you can set the groundwork to optimize the situation where you've done everything else to support sleep, but now you have this thing that's not really related to your circadian rhythm that is creating a flight or fight response, basically. Right, and that's something that's beyond the scope of what we're talking about here. But still, that person could do some of these, implement some of these things to at least get their circadian rhythm optimized.
Yeah,
it could only help. It's likely not going to cure that, but but it would certainly help support anything else they do.
Is something like a therapy going to be probably the thing that?
It's usually a multifactorial thing. It's a combination of things, not only like cognitive behavioral therapy, someone that's really also experienced in dealing with PTSD, a therapist that is. And there's many other kind of methods to support that, to kind of bring down the, whether it's acupuncture with it, it's not in place of, but to kind of bring down that flight or fight response.
Acupuncture, like at home, like
no, I mean,
or like sessions.
In sessions.
Okay.
So typically in the military, I was actually also certified in medical acupuncture, and one of the things I was doing with our psychiatrist, because we had a ton of people at our on our base deployed all the time, is I'd have them do some auricular ear-based acupuncture to kind of basically just
inner ear.
Just stimulating the vagus nerve basically, which will help decrease the flight or fight response. And they'd go right into their session with the psychiatrist. And his feedback was that he was making a lot more progress with them because they're coming into it already with their kind of flight or fight state reduced.
Yeah.
So I'm just saying it's a supportive thing. There's all kinds of things that people are doing now. I could probably have, again, Carrie come in and talk about things with other causes of insomnia, like traumatic brain injury and PTSD, and some of the things she's doing to help people. But that's a good one. It's a tough one too. But they definitely
there's a few things to chip away at.
But I would definitely get things optimized first, and then work on that way you have. Because if you have all the circadian rhythms all messed up and all that too, it's going to be a nightmare.
Yeah, you're just compounding the issue.
Compounding it, yeah. So, but that's all I would have on that.
Yeah. We got another.
So this one's not necessarily related to sleep.
Yeah,
Okay.
it's okay.
Okay. So how can life, wellness, balance translate to sport performance?
Ooh.
How can life and wellness balance sports performance?
So I'm trying to figure out what the meaning of that question is. Some things we could maybe read into it is, so for instance, if you, let's go back to our previous episode, the stress cup thing. Let's say you have a high amount of allostatic load. It's affecting, a body and brain are affected, especially, when we're talking about performance, are we talking about things that are like, I think you previously brought up something like golf.
Right. Yeah.
We could deal with anything. Like some people, and this is jujitsu too, some people will, like, I think we've talked about, like someone putting, and they can just go on their own and practice and do fine. But when they have like a clutch shot, let's say they're trying to make where they have a lot of pressure on the outside, getting into obviously optimizing health and wellness with allostatic load and all that will decrease the flight or fight system, and get into more of that kind of, people talk about getting into that flow state, which is very much parasympathetic, that alpha wave state in the brain, very much, getting in the moment and not letting these outside things.
Which is kind of, if you imagine that stress cup, if your life and wellness side is being managed better.
Yeah.
When you're in those moments, which is going to start activating that fight or flight, whether it's a, intense situation in sports or something like that.
A little more resilience.
Yeah, exactly. You'll have some more resilience and you'll be able to stay calm to perform that task.
More able to, because you've done the groundwork for everything else. Now, there's also things just to desensitize the really train yourself to get into that, really, that they call the mindfulness stuff where you're kind of in the moment there and you're not looking at these external things. You're just doing it for the sake of doing it. Not like, oh gosh, I got a lot riding on this shot. Like, I think we've talked before, like, doing a free throw at the gym, like by yourself practicing, you can sink it a bunch, but then you're in a, you're down by,
just 1 point.
At the end of the game. And then you got to make this thing.
Yeah.
They call it clutch performances, right?
Right. Which I think kind of goes into the next question. They mentioned something similar.
Oh, it's the same person?
Yeah.
Okay.
Yeah, it was when faced with a simple task like a free throw or missing an ideal position advantage in jiu-jitsu, how does the increase in competitive pressure increase the difficulty of otherwise everyday simple tasks?
Yeah, that's exactly what we were talking about.
Yeah.
So if you're able to that's what they call that flow state, where you're much more, you're active, but you're kind of in the zone.
So how would you try to exercise that?
Oh man,
getting into that.
Gosh, if I had the good answer to that, I'd be making like millions of dollars in self-help books. I can tell you personally, I think reframing things in the grand scheme of things, like, okay, this winning's important to me, but just I'm really truly believing I'm here just for self-betterment, the act of competition, and I don't have my ego or my self-worth or anything like that on the line here.
Mm-hmm.
And being able to, that's why they always say, there's people at the gym that can just crush it, right? And they get in a competition and there's like, where'd that person go?
Right.
Yeah, that's what I'm talking about.
Mm-hmm.
And that's so difficult to do.
I think from my experience, what's helped me in performance moments is, so in baseball, they want, when you start getting more competitive in baseball, and I think this is actually the same with golf, is as a batter, they tell you to get almost like a routine for each pitch. And that's why Nomar Garcia-Parra, a golfer, I think his last name is Bradley.
Mm-hmm.
They have this thing where when they're about to step up to the ball
Mm-hmm.
for golf, or they are about to step into the batter's box,
Mm-hmm.
they adjust their gloves and they do this, and then they tap, you know.
Have a ritual?
Yeah, they have this ritual. And I remember when I was playing competitive baseball when I was younger, 17, you know, 16, and then 18, that every time they're like, you need to have this ritual, even in the batting cage, like, you know, you're not doing it every single time, but you're going to have moments where you're practicing this ritual and you're getting your brain to trigger. I'm hitting now. I'm looking for the release from the hand, you know, in pitching, you know, the guy's how he's throwing the ball. You're looking for tells. Your brain is completely locked into this moment, which is hitting. You're not thinking about anything else.
That's right. You're able to.
Exactly.
I think that's so similar. You could think archery is the same way. You could sit there and have like really good groupings at home, and then you're out there hunting the pressure shot, right?
Yeah.
But if you have those kind of things, like, okay, it's a sequence, it's a movement.
But you have to practice it.
Oh, you do. It's got to be in great, right? Then it's like your brain goes, okay.
Yeah. So if you have, and I don't use that a whole lot now in like the sport that I do now is jiu-jitsu, and I play golf. And I do have a routine when I am putting and when I am doing the first shot off the tee. But I think it's definitely better if you can practice that. So when I go to the driving range or I'm on the putting greens and stuff like that, practicing that, you create something that starts to clear all these other things out of your mind so you can get into that mode. And I think in a jiu-jitsu form, if you have something in, let's say, sparring, where you slap and bump a certain way, you know, if in jiu-jitsu it's really good after you slap and bump to adjust your sleeves and get into a good tight elbow position, even if it's standing, right? Because now you're making your sleeves difficult to grab,
right?
And, you know, as much as you can without getting slapped by the ref. But it's good to have some sort of movement, something that clicks in.
Yeah.
And then, so when I teach the midday class, I typically start the classes with some sort of gripping exercise and creating dominant grips right off the bat, and then capturing the tempo, which Keenan Cornelius talks about a lot, which is you want to start the tempo of the match. You don't want them to start movements
and play in their game.
Then and maybe you have a defensive game, but you can still establish the tempo by getting your grips, and then you play off their grips, which is fine. But you're kind of, if there's water kind of going in dirt and you're putting your finger down there, you're directing where that water can go by having at least one grip. So you're establishing tempo.
Well, that makes sense, though, because and then it becomes just it's like a habit of everything else. Where I think that's what I was getting when people describe a flow state. They're not thinking about, oh, well, this guy's, you know, it's just like, here's someone in front of me. I'm doing my thing.
Right.
Yeah.
Yeah, exactly. And I think even so, like I did a tournament, I don't remember how, a couple months ago, something like that.
Yeah, it was in December.
December, yeah.
Yeah, right before Christmas.
And, you know, I made it a point to, and I think this probably comes from the baseball training, but as I was warming up, half my warm up was just the very beginning of the match. Because I know once I got through the very beginning where all the nerves are, then I'm just rolling.
That's right.
Right. And I'm also reminding myself of that. And I think this would help with a golfer or any sport is you do this every day or all the time.
I think that's very true. I was watching that one of those matches right at Matt's side that you had. And something that struck me is, especially when you were in guard, it's like you were having a picnic. You're playing with the lapel, thinking about it. There's no urgency. You're like, I know what I'm going to do. You know what I mean?
Right. Yeah. I was able to break through that nerve barrier where you're very rigid. And if you're a golfer and you're rigid, it's ugly.
Well, and it's funny you ask because that's something I constantly struggle with. And as you know, Bill, and I think that's a great something I'm always working on too. So it's a really good question.
It's more so in the beginning too with you. I mean,
Then I'm fine.
we've drilled guard pulls
Yeah.
a lot, but even in drilling, you'll
Yeah.
get tense with the anticipation of a tournament coming up.
Right.
But once you break that guard pull, that
Yeah.
initial
Yeah.
engagement, the rest of the sparring round or whatever it is,
Yeah.
is so much smoother once that seal gets broken.
And I think just by repetition,
yeah.
just for me and everybody else, I think then you get used to it, and the threat response isn't there as near as much anymore.
The ego response too, because that was
Big time.
big
Yeah.
thing for me was like I see you, I see a lot of our team right there. I'm like a nomad, so I know a lot of people, and like I train with a lot of people,
Yeah.
and I see them for me to get past that thought of like they're gonna think I suck if this guy just smashes me.
Right.
I have to be like, no, hey, this is just you win some, you lose some. Like
That's right.
I mean, now in the moment, I'm going through like it's like a wave. Like I'm thinking good things like that. Like I do this every day. It's all good. And then at the same time, like, well, I could get pantsed, and then he could crush me. You know.
Right.
So it's definitely a battle, but practicing that in the gym or on the practice facility or whatever is like actually putting yourself in that mindset.
I think that's the key.
Yeah.
I really do. Just habituation of it, so it becomes not as like, oh my gosh, you know.
What did you tell me?
I said habituation.
Okay. My mom's not gonna like
That's
that.
gonna be your new name.
Well, Craig Jones already stole my power bottom.
Oh, dang it.
nickname,
That's no good. Well, you'll have to go beat him up.
I think that was all the questions, right?
Yeah.
Yeah.
Yep.
So I think we're going to keep on a theme, maybe of like that whole emptying the stress cup and maybe a little more recovery stuff. But send in questions, please.
Yeah, definitely like getting all the questions.
Yep. Anything else, Bill?
I don't think so. We have, once again, just plugging the cholesterol episode will come at some point. We're still building on that.
Carrie's getting ready to do a hormone thing for us.
Carrie's going to come on, talk hormones. We're going to have Brittany coming on again. Andrew's going to come back again.
Right.
Anybody that's doing the strength phase 1.
Oh, we got to do that soon.
Yep. We'll be filming phase 2 here. But anything that you're wondering about with phase 1, shoot that stuff in. And yeah, Grappling With Podcast at gmail.com. Instagram, Grappling With Podcast. Facebook, Grappling With Podcast.
I'm glad you do that because I'm terrible at that.
Yeah. You just hit us up on any one of those email DMs.
Well, awesome.
Slide in my DMs.
Thanks. And Olivia, as always.
I'm not literally. Liv,
Thank you.
Come on. Okay. Play the music.
We're out of here before you get in trouble.
Jeez.